Recording. Right, Andrea. Making my self-care a priority, that is definitely a good one. Goal this year is to read 25 books. Come on now. I love that. So good afternoon, everyone. My name is Charlton Brown. I am the Diabetes Program Manager in our Chronic Disease Division here at DC Health. I just want to give you guys a warm welcome. Thank you for joining our February Diabetes Community of Practice this month. We have some great information, a great presentation for you today. If you have not seen the chat, I want to know who's in the building today. So definitely, please give us your name, your title, your organization, and any personal goals as an icebreaker, any personal goals you have achieved this month or goals like you would like to achieve, upcoming goals that you would like to achieve. Tongue twister. Okay, Mary, I'm not going to the gym at least 18 days this month. Come on, dedication. Dedicate. I wish I could do that. February. I reached out to local elected officials to stress the importance of SNAP and WIC funding in Farm Bill. Come on. Love that. All right, Dr. Manjula, stay healthy. Definitely. I don't know what's in the air, but I just feel like there's so many things in the air. People are getting sick, but definitely staying healthy is key. Thanks for joining, Dr. Ayok. Personal goal, made it to the gym at least 2 days a week. Yes, because I can't even make it one, but I'm trying to. All right, we're just going to give 2 more minutes and then we can get right down into the education that we're going to receive today. Once again, my name is Charlton Brown, the Diabetes Program Manager here at DC Health in our Chronic Disease Division. I just want to give everyone a warm welcome and thank you for joining us today. We have some great information today. Okay, thank you, Carla, for joining. Personal goal, trying more new restaurants in DC. Is there any recent restaurant that you tried and you would like to recommend to all of us?
Great question. There is a new restaurant in Southeast that opened up across the street, Sapadia's. It's not new to DC. This is the second location. I have to try that one. And I just tried another restaurant. It's a French restaurant in DC called Minetta, which was really, really yummy.
The name sounds cute. So.
Yes.
Definitely. So we're just going to give everyone 1 more minute and then I will pass it over to Mariana. Has anyone ever been to Mallard in Logan Circle, Shaw? I have not. All right, it is 2:05. So just before we start our conversation, once again, thank you all for joining us in our diabetes community of practice. Throughout this presentation, if you have any questions, please drop the questions in the chat. I'll be monitoring the chat and I will pass it on to my peer, Mariana.
Thanks, Charlton. Good afternoon, everyone, and welcome to the Diabetes Prevention and Management Community of Practice this month. My name is Mariana Jimenez. Once again, I serve as the Health Equity Coordinator in the Chronic Disease Division here at DC Health. Got a great presentation for you all today with information on diabetes prevention program And today's presenter is Tessa Mork. Tessa is Association Director of Community Health for the YMCA of Metropolitan Washington. Tessa comes to the Y with a public health background and has been with the Y for nearly 10 years. In her capacity as Association Director of Community Health, Tessa oversees the implementation of the Y suite of evidence-based health initiatives, including DPP, BPSM, SNAP-Ed, nutrition counseling, and produce prescription programs across DC, Maryland, and Virginia. Please join me in welcoming Tessa today.
Hey everybody, thanks for having me. I'm gonna share my screen here. Give me 1 second. All right, hopefully you guys can see my screen. Yep, awesome.
Yep, we
All
see
right,
it.
if anyone has any questions, feel free to interrupt me or drop them in the chat at any point. As Mariana mentioned, I am Tessa Mork, and I'm looking forward to chatting with you guys today. I will say I will get really out of breath. I'm 8 months pregnant, and it is unclear if my lungs are still in my body, so bear with me as that happens. All right, today I'm going to talk a little bit about full CDC recognition, some of the standards of this, how to maintain it, and some of the benefits. I'm going to address umbrella hub arrangements, talk through the WISE Healthy Living Framework and our program, and how we integrate wraparound services into our program within the district. All right, so we have had full recognition from the CDC since 2011. So gosh, that's going on 14 years. Full recognition from the CDC, this designation is reserved for programs that have effectively delivered a quality, evidence-based program that meets all the standards for CDC recognition, which I'll get into in this next slide. All right, so the standards for CDC recognition, first is the use of a CDC-approved curriculum. Here at the Y, we use the Prevent T2 curriculum, which is the same one that Ys across the nation provide. The next standard is offering whatever curriculum within 6 months of receiving your approval from the CDC. We've been offering DPP basically continuously for the last 14 years, so that puts us in meeting that standard. You have to have capacity and commitment to deliver the program over the first year, and that would be at least 16 sessions during the first 6 months and at least 6 sessions during the last 6 months. Really important piece here is that you have to be able to track and collect data on participants' progress, including, of course, our key markers here, weight and physical activity minutes for every session, and these have to be submitted every 6 months. So this is kind of easy for us at the Y. We use a data management system called WELD, which is specifically designed for nonprofits. A lot of Ys across the country use WELD. And it's designed to track DPP. It has each of the modules within it, and we're able to really easily track our outcomes in it. Luckily for us, YUSA, which is kind of our parent company, they facilitate data sharing with the CDC. So that, I think it's a 6-month requirement. We have to make sure our data is in WELD, and then our YUSA team will share that with the CDC. The next recognition standard is you have to have trained lifestyle coaches who can help build participants' skills and confidence to make lasting lifestyle changes. Again, this is a little bit easier for us at the Y because we have an internal lifestyle coach training that's facilitated by YUSA. If anyone's curious on what that looks like or the standards for that, I'd be happy to share more information about that. And then the final standard is to have a designated individual to serve as your DPP coordinator. All right, so the importance of maintaining CDC recognition, basically this is just to help ensure that your program's quality and effective, and making sure it has visibility and credibility. So for program quality, CDC recognition ensures adherence to an evidence-based protocol, which, as we all know, is critical for sustained behavior change. For program effectiveness, it helps programs achieve our outcomes that prevent type 2 diabetes, which we have our 5 to 7% body weight loss and 150 minutes of weekly physical activity. And then finally, for program visibility, increasing the program's visibility and credibility, which ideally leads to an increase in referrals from healthcare providers or even an increase in grant funding. So one of the biggest, in my opinion, benefits to CDC recognition, to full recognition here, is the ability to become an MDPP supplier. So a full CDC recognition is the first step to becoming an MDPP supplier. MDPP is Medicare Diabetes Prevention Program, as I'm sure we all know here, and that allows us to bill Medicare for the services that we're providing. I will say that we don't do this at the Y. We've attempted to, even though we've held our full recognition for 14 years. The Medicare, the MDPP application is really hard. If anyone else on the call has tried it or been through it, or if you are an MDPP supplier, you know it's tricky. But so in order to bill to find that financial sustainability for our programs, that first step is to have a full CDC recognition, which then makes you eligible to become an MDPP supplier. So you have to go through that application process online. And then the third step is to wait and hopefully receive approval from your program. While, like I mentioned, it can be really tricky, especially for single providers or smaller nonprofits to go through the process to be an MDPP supplier. So if you can't get full CDC recognition, that doesn't mean you won't ever be able to bill. I'm sure most of us are familiar with this concept here of an umbrella hub arrangement, or a UHA. If you are unable to get full CDC recognition, but if you are a member or a subsidiary of a umbrella hub organization, that full CDC recognition confers onto you. And I'm going to talk a little bit more about umbrella hubs in this next slide here. All right, so for those of you who are unfamiliar with an umbrella hub or a UHA, it's basically just a business approach to help connect CBOs, community-based organizations, with a healthcare payment delivery system to get DPP reimbursement, which is, of course, you know, our vision here in being sustainable. So the first benefit within that is that shared CDC recognition status. So if you are pending your recognition status or have partial CDC recognition, anything outside of full, so long as you are involved in an umbrella hub arrangement, that has full, it'll have full CDC recognition, you get that as well and are able to practice under the title of a full recognition. So under the business approach idea here, basically a UHA is going to help with all of the billing and kind of the back end work of being an MDPP supplier. So if you were to join an umbrella hub arrangement, that arrangement would be the ones who went through the application to become an MDPP supplier. So that wouldn't fall on you as either an individual or a smaller organization. Ideally, they're sustainable in this current climate. Truly, who knows, but hopefully they continue to remain a sustainable option, and just helps us achieve economies of scale. So when ideally, though, there's multiple CBOs within an umbrella hub arrangement, just increasing our billing power and our ability to provide simplified billing and reimbursement. It's probably not simplified for whoever is doing it, but for us as a smaller CBO, having that taken off of our plates allows us to focus on what we are best at, which is implementing DPP. And then finally, this can help bridge participant changes in coverage. So often an umbrella hub arrangement will contract with multiple payers, so Medicaid, MCOs, and commercial health plans. So of course, since DPP is a year-long program, it's likely that someone may change, that someone's coverage may change over the course of the year. And hopefully if you're in a UHA that has a variety of payers within the contract, we can make sure that our participant is covered the entire time. Little food for thought for us here. So I can share this link in the chat at the end, but this comes from the National DPP Toolkit website. And this is just locations of sites that are part of umbrella hub arrangements, or sites that like are the umbrella hub. You'll notice we don't have any within the district. I know some Ys, for example, I think this pink dot here is the Rappahannock County Y in Virginia, and they're part of a umbrella hub arrangement from our Milwaukee Association. Prince George's County Health Department is an umbrella hub, or they are an umbrella hub, and so they have quite a few providers. Probably all of these ones here are within theirs. I'm not sure about the rest of these. I think there's one kind of like private organization as well. That's a UHA, but something for all of us to consider here on this call is if DC Health were able to act as a UHA in the same way that the PG County Health Department is, we could all be in an umbrella hub arrangement together and build and have a really sustainable program across the district. All right, so talking through the Y's role in this space, I just wanted to show you, oh yeah, totally linking care. Thank you for whoever said that. That's the other one that that shows up, I guess, probably around here. So the Y's role in this space, this is our healthy living framework, which is kind of our public health model here. But basically, you know, as with all of us in public health, our goal is to create impact from individuals all the way through society and address three, both primary, secondary, and tertiary care. And part of that we do by our diabetes work. And then all of that, you know, through our membership, all of our other programs, our advocacy, et cetera, we ideally impact health at every possible point here. So I'm going to talk a little bit about a current program that we're running and how we partner with an MCO to make that happen. So I'll start by saying the first step of this was for us to establish a data sharing agreement with a local MCO. So we had one in place with Care First prior to them losing their contract. We now have one with AmeriGroup, and that's the only one we have a partnership with. Ideally, if this were to work best, we'd have a data sharing agreement with each of the MCOs that operate within the district. But so we have a MOU and contract data sharing agreement in place that allows AmeriGroup to send us bulk referrals and individual level data. So AmeriGroup is able to filter their membership list for members who qualify for whatever specific health program we want to enroll them in. This particular program is a partnership that addresses diabetes. And so we're able to receive referrals from all of their patients who are pre-diabetic. They filter their membership base for these criteria. They send it to us. We've used an SFTP site or a locked Excel sheet, kind of depends on the MCO and their system. Our team then takes that list and does recruitment and engagement to hopefully enroll those folks into our diabetes prevention program. And then we share back our data with the MCO on an agreed upon schedule. It's typically quarterly. We'll share updates on this is how many referrals we had, this is how many enrollments we've got, and then here's some of the data on participation. This system ideally allows the MCO to evaluate some of their cost savings and HEDIS metrics, and is kind of a win-win for both the MCO and the CBO in this case. All right, so a couple different ways that folks can refer to us. We have an SFAX, we have a HISP email, and CRISP on Bertha, and LinkU, all important so that folks can access our services. This program that I mentioned in this AmeriGroup partnership has kind of three key facets. The first one is the program referrals that we receive from our MCO. After they're referred to us based on their pre-diabetes status, we enroll them in our diabetes prevention program. We then, in this particular case, will enroll them in a year's worth of medically tailored groceries that's delivered straight to their home, as well as a medical membership, which is a full service membership with our Y in DC. The first component of this program is their produce prescription via Hungry Harvest. As I mentioned, it's home delivered. Each box has 2 to 3 fresh fruits and 2 to 4 fresh vegetables. ideally enough to feed the whole family. These prescriptions are dispersed on a weekly basis. That shouldn't say 12 weeks, that should say 52 weeks. We do these over the course of the year with this AmeriGroup program. Second component here for our AmeriGroup members is a full medical membership. So 1 year fully paid at YMCA Anthony Bowen. That membership includes Group X classes, both land and aqua, as well as complimentary childcare that's provided to you during your workout. And then that confers access to all the Ys in our region. So Alexandria, Arlington, Bethesda, Silver Spring, Reston, in addition to YMCA Anthony Bowen. And then, of course, all of our beautiful equipment and spin studio, weights, cardio machines, etc. In addition to those program structures, did someone have a question?
Yes. So the question is, how are you supporting the hunger harvest and the YMCA membership?
Great question. I love a funding question. So this is currently funded by GusNet, which is a USDA grant. So we approached AmeriGroup. We said, hey, we have this funding from GusNet, which we've written in our DPP classes for 150 individuals plus produce prescriptions for 150 individuals. So we approached AmeriGroup and said, hey, we have this thing that we can offer your members. Can you pitch into and can we create a program together? So they're covering memberships while we cover food and DPP enrollment for the program. I think it was really helpful to go into that conversation with something that we could offer, and then that made the ask from them a little stronger. So in addition to those kind of core program supports of DPP, the Hungry Harvest, the produce prescription, and the Y offerings, we try to provide as much wraparound support as we can in addition to that. So for all of these folks, we offer waived enrollment in our blood pressure self-monitoring program. We know that chronic disease typically goes hand in hand. So making sure that if folks have hypertension, that they're are eligible for this program as well, where they get a BP cuff sent to them in the mail and they work with a Healthy Heart ambassador over the course of 4 months in office hours and nutrition seminars to learn how to take your own BP, understand your triggers, know how to lower your risk. In addition to that, in the district, we of course also hold the SNAP Ed contract. And so we offer, and this of course goes really well with the produce prescription, but also offering culinary education for folks as well. So especially if someone in this program is now getting all of this produce and doesn't necessarily know what to do with it, free enrollment in either our Taste of African Heritage class or our Simple Cooking with Heart class, where they would learn some nutrition basics as well as some culinary basics. That's all I have. I know I talk really quickly, so I hope it wasn't too fast, but my email is right here, tessa.mork@ymcadc.org. I'm happy to take any questions about CDC recognition, umbrella hub arrangements. Happy to strategize with anyone. If you are in an umbrella hub, I would love to know your experience, or if anyone is thinking of joining one, would love to know more about that. And then also happy to answer any program specific questions on our DPP AmeriGroup project that I just outlined.
Thank you so much, Tessa, for all that information. And if you have questions, please unmute yourself. We do have a question. Do you foresee any impact with your current DPP program as discussed with any of the executive orders?
That's such a good question. I spoke of that as if we were all moving and grooving and everything is great. Our Gustum funding is currently on hold. We were advised that it should not be on hold much longer, but that was kind of an immediate issue. Since that's largely funded, since that is funded by GusNip and the USDA, that is supposed to be safe, even though there was kind of that blip when all funding was paused. As soon as our funding reappears in the ASAP portal, we should be good to go. And then, I'd like to say in theory, everything else should be fine and stable, but we're not really operating in a space where I can base off of past experiences here. So hopefully the rest of our programs won't be affected, but we don't know.
And with your referral process on Bertha/Link how does that work? What's the turnaround rate for somebody to get in contact with the patient? Is there somebody that is manning the station on LinkU that is responding back? If you could let us know how that works.
Yeah, so we have our diabetes prevention coordinator is the one accepting our referrals. Since we work primarily with an MCO, like our program runs mostly off of those. But like I said, we have a staff member dedicated to kind of triaging all of these external referrals that comes in. And so she'll, as soon as they come in, she'll reach out and enroll them in a program as appropriate.
Thanks, Tessa. Also have a question. Can you speak a little bit more on the process of partnering with the MCO and about how long that took you to establish that partnership?
That's a beautiful question. So that took us about a year so as I mentioned, we had a previous partnership with Care First, where we'd had a data sharing agreement. We'd had kind of the same programmatic structure that we'd implemented, and we were gonna implement this second pot of funding with them until they lost their contract. So we had to start from ground zero with the Mara Group. So from that initial conversation where we found someone at a Mara Group and we said, hey, we have this thing, we want to partner, to getting our contract signed, it took a year. And that was a lot of back and forth with senior leadership on like the contracts themselves. So that was tricky. And we are not an MDPP provider. This is kind of our workaround at the moment, these direct payer relationships with MCOs, and these like contractual based relationships. Honestly, the application process for Medicaid and Medicare were just really tricky. We tried it. We failed. And so our next approach is going with a UHA, an umbrella hub agreement. We think we're going to join the PG County Health Departments. And then of course they would take all the back end billing and do all of that for us. We'd like to keep it local. If not, we would join, there's another Y in both Milwaukee and New Hampshire that have UHAs that are accepting Ys across the country. But we'd also be open to making like a DC specific. If DC Health wanted to take the lead on being a UHA, we would join it very rapidly.
We do have another question from Paula. How many team members are a part of your DPP efforts, or how many do you feel are appropriate for it to run successfully?
That's a great question. So we have one full-time member staff overseeing this. She also oversees our blood pressure self-monitoring program as well. And then we have about 7 part-time staff who are our lifestyle coaches, who are the ones actually implementing DPP. So kind of a tricky question to answer, just because it's our part-time staff that are the ones who are actually serving as lifestyle coaches, and then we have a full-time person doing kind of all of the rest of the admin stuff. We have 7 on staff currently because this program will cover 150 people, and we wanted to make sure we had weekend classes, business hour classes, evening classes, etc. So we needed a pretty wide range of folks to be able to capture all of the different times that some of our participants would want to take DPP.
Hi, Eileen Cervantes del Toro here. Thank you for your presentation. I am curious, I love the wraparound services that you mentioned, and I think they're so essential to really addressing health-related social needs and really providing folks the support they need as they are making those lifestyle changes. With that said, what advice, if any, would you have to, delivery orgs that are interested in providing more of those like wraparound services, like where to start, tips, things y'all have learned, I mean, I know obviously being a part of the Y a little bit easier in terms of actually having access to like an exercise facility, but yeah.
That's a really good question. I would start with suggesting you reach out to SNAP Ed providers in the district. I think that's a really obvious one. That's free for participants, no cost in partnering with us. And a lot of our SNAP Ed work, we, of course, the curricula that we have to follow is all evidence-based within the SNAP Ed toolkit, and so often ties in really well with diabetes prevention programs. I think there are a couple of us, we do adult and senior-based education, some do more kids-based education, but looking into SNAP Ed is a really easy and obvious first step on a strong wraparound support.
Thank you.
We have another
Paula, I
question.
see your question. Would 1099 contract lifestyle coaches help with this? You're saying like as your part-time people who are implementing the program?
Sorry, I had a hard time unmuting.
No
Yes, in
problem.
general, you mentioned that you were trying to make the program available to about 150 participants. And so whether it's you or another organization that's just trying to have more lifestyle coaches, I was wondering if having, instead of part-time or full-time folks, 1099, kind of like lifestyle coaches that would just come in for that particular session.
Yeah, seems to me like that would make sense. Just the way that we operate at the Y is we typically bring folks on part-time under staff as opposed to contracting with folks. But if you're an organization that's familiar with working with 1099 staff, I think that's a great way to get lots of folks on board who can teach a variety of different times.
Okay, thank you.
And then I see, Andrea, your question on costs of the required advanced trainer training for all our DPP lifestyle coaches. So we use Y curricula. We have a system that's created out of YUSA called Learning Career Development Center, where it has all of these paid trainings. And so I think to get someone certified as a lifestyle coach through the Y, it's like a 2-day training. And they have to take a ton of prerequisites. So like HIPAA, healthy living at the Y, like a couple of different things. And typically those are pretty low cost, like $10, $20 at our webinars. And then it's that 2-day training session to have their training finished. And then we just, have to be aware of the cost of that and budget those into whatever grant funding that we have.
So I think Andrea might be referring to the advanced coach training that's required following like the actual training of the lifestyle coaches. Is that platform allow for that and you have like essentially recorded videos from the different MOU entities? Okay.
Yeah. Now I ask the room a question. Is anyone here an MDPP supplier or in an umbrella hub?
So no to both, but I work at the Maryland Department of Health and I am overseeing the Eastern Shore AHEC in their development of an umbrella hub arrangement. And so I'm working with them on becoming and also other state delivery orgs that are interested in becoming DPP suppliers. So yeah.
So can we reach out to you and you can help us become MDPP suppliers?
It's a great question. I know that I think DC was also doing some work on that, but I mean, I'd be happy to connect with you, Tessa.
And then can I pose a question to DC Health? Are there any conversations about umbrella hub arrangements or any guidance from you guys on billing for us in DC?
I would like to direct the message to Shannon, if you're online.
Sure, I'm so sorry. I was trying to unmute here. It's, had so much going on. So we have not explored the idea of DC Health serving as an umbrella hub. I think this is a good, healthy conversation, and one that we will pursue or discuss offline as a team. We have in the past engaged with APHA, so the American Pharmaceutical Association, I'm sorry, yeah, American Pharmacy Association, on them serving as a DPP hub. They have, I guess we can talk about this openly. So they had been working with Kroger as part of the Albertsons Kroger merger. So we were actually going to work with them on engaging chain pharmacies through that merger. That obviously didn't happen. So we're kind of pivoting our approach there. But that's still an option that we can pursue under them as an umbrella hub. Yeah, we can explore DC Health being an umbrella hub, but absolutely this is something that we've discussed because we acknowledge and we've heard from our partners that the administrative burden of managing these programs is real. And also the umbrella hub, I think, would allow, so beyond the administrative burden of reporting and billing, it could possibly allow for some shared resources and to address staffing capacity gaps. So absolutely, this is a strategy that we're interested in. So
That's great. I'm
we
glad
can
to hear
work
that.
together on figuring out what that might look like, and who else is interested in being part of that.
You can put us at the top of the list for interest in a UHA.
Okay. Okay, great.
Thank you for that, Shannon. Are there any more questions? If there are no
Was the
questions,
question about billing answered if they're billing for these services? I apologize. I saw it in the chat.
We're not, no.
Okay.
We hope to soon.
Good luck. I hope it happens. It's
Thank
tough
you.
with DPP.
Yeah, it's tricky.
go
I
ahead,
see
Ms.
Andrea,
Holmberg.
you have your hand up.
Tess, I'm happy to talk with you offline. I have been an MTPV supplier and a program coordinator, and we reached full plus at Providence Health System. This is I left in 2022, but I'm happy to maybe share my experience with you and see what you're missing. What piece are you missing in your application? I know that you need to be a Medicare provider before you apply. I didn't hear you talk about Medicare being one of any of your coaches Medicare credentialed provider. That would be my one question for you.
Like they all had NPIs, Andrea.
Yeah, they have to have MPIs.
Yeah.
So if you don't have
To have
staff,
that piece down.
you have that piece down. Okay.
Yeah. I would say honestly, our biggest struggle is the why typically not being within the healthcare space. And I think our senior leadership gets a little flighty when they see a contract. I think the contracts honestly are a little bit scary for someone who's not used to seeing like a medical contract. And so I think it's more of like a culture change that we have to shift, which is hard. We're not unwilling to do it. We've been trying for a couple of years, but I would say that our UHA dreams are kind of someone else taking on that contract and being able to understand the burden and the legal language and all of that, and us just kind of operating under it.
Okay.
Andrea, are you currently billing in DC?
No, I'm a credential provider with Aetna and Care First, and I reside in Maryland with my business. But I can see residents in DC because I have a license in DC and Maryland for medical nutrition therapy. I'm not involved in a DPP currently.
Okay,
Yeah, I just have past experience running them
gotcha.
for several years.
I'm gonna reach out to you on the
Okay,
side.
sure thing.
Any more questions, comments? I definitely want to give everyone the opportunity, if you have any upcoming events that you would like to share with this group so we can help support, we can help promote. If you would just take yourself off mute and then share any upcoming events that you have coming up.
Hello, everyone. My name is Regina Jefferson. I am so happy to be in this group or be a part of this group. I work as a stakeholder engagement coordinator for DC Health, and I just want to announce our upcoming Places of Worship Advisory Board General Body Meeting. It will be on March the 14th, 2025 at the Department of Health on the 5th floor, and it's from 12 to 2, and we will be providing lunch, but it's a great place to network and to meet other faith leaders as well as other business partners. So thank you for this opportunity, and I approve this message.
Thank you so much, Ms. Regina. I'll get in contact with you to get some more information so I can send that in an email as well. Are there any other events, programs, health fairs?
Hi, everyone. Can you hear me okay?
Yes.
Hi, this is Vivian with Sorogi. I just want to let everyone know that we are going to be hosting live cooking demos starting in March as part of SNAP Ed. And this is open to DC residents. And we are going to be having them every other Tuesday by Zoom. And we're also going to be streaming that through Facebook as well. So if anyone needs nutrition, general nutrition education, cooking demonstrations, please reach out to Sorogi. And we do have a registered RD or registered dietitian who's going to be hosting those sessions. So please let us know. And once we have the flyer finalized for March sessions, I will share that with Charlton so he can have everyone in the group get them. So excited about it, and hopefully we get more DC residents to join and learn from our RDs.
Thank you so much, Dr.
Clarify, Vivian, is it only virtual, or will there be like a certain amount of patients that can come in person?
No, right now, because of the weather and everything, we had hoped to have some in-person sessions, but now it's all going to be through Zoom. But once the weather gets better in April, May or so, we would definitely have in-person sessions. So, but for now, they are all going to be by Zoom at 6 p.m. Tuesday evenings, every other Tuesday starting in March. Thank you, Charlton.
Thank you so much. Do we have any
The
other?
Y holds an event every year called Healthy Kids Day. It's the last Saturday in April. If anyone would be willing to, or know anyone who would want a table at our YMCA Calamaris, which is on Allison Northeast, or at YMCA Anthony Bowen, which is in the U Street neighborhood, we're always looking for health partners to come out and provide engaging tabling for family-based any type of health education on that day.
We'll definitely connect with you and get that information, and hopefully DC Health will be present. Any other events? Any other questions? All right, Tessa, I just want to say thank you for providing us all with this great information. We greatly do appreciate your time and congratulations on your baby. You did a phenomenal job breathing through it.
Thank you, I
Um,
tried.
And also, thank you to everyone that attended this meeting and inviting people into this meeting. As we say, the greatest thing that we can do is making sure that we're sharing this education with our peers and community partners, making sure that we're sharing the link with our partners and getting more people at the table to make a difference. In this climate, we just need to educate, educate, educate. Sometimes we need to pivot. So being able to pivot and get this education out there and working together as a team to overcome the big picture is key. So our next Diabetes Community of Practice meeting is on April 22nd from 2 to 3. After this meeting, probably by Friday, I will send a recap of this meeting, the video recording of this meeting, and a post survey just to know what we can improve on. What would you like to hear more of from our Diabetes Community of Practice? So just be prepared for our next Community of Practice, any upcoming events that you have, any flyers that you would like. I'm sorry, I said April, March. I'm trying to jump months. Any flyers or any education that you might want to share with us, just let us send it to us so I can put that in the email and blast it because we are working together on the overall big picture. Without further ado, I know everyone is super busy, understand. So I am going to give you back the gift of time. And I just want to say thank you so much from DC Health. We greatly appreciate you joining us for February's Diabetes Community Practice. Any last remarks, Mariana?
None from me. Thank you so much, everyone.
All
Thank
right.
you,
So,
DC Health, Charlton, and Tessa. Have a great day, everyone.
you as well. Thank you. Have a beautiful day.